What's your sense of how technology and new investment models can really revolutionize reach, access, and importantly quality in the field of primary healthcare? Where are we going?
Let me start by saying that if you want to revolutionize healthcare in total, which is very much needed for a variety of reasons that are well known, you need to start at the basis, which is primary healthcare. And the good news is that because of innovations, both in technology and in products, we see that there are more and more enablers to drive that revolutionizing of the primary healthcare. Now, the key point that we need to focus on is that we don't define innovation too narrow. It's not only technology, it is also business models, it's financing models, and we make sure that the various parties that have to contribute to the solution have aligned incentives.
What about the Philips approach? I mean, what's unique about your approach to financing technology and the marriage of the two?
We started to realize that just by innovating in the products and technology would not do the trick. It also needs to be locally relevant innovation, which is why we decided to put an innovation hub in Nairobi, Kenya, to gather insights from the local health systems, markets, doctors, nurses, and develop products and innovations for that reason. But this notion of innovating in terms of setting up the ecosystem, mobilizing those various parties in the ecosystem, that will be the main source of competitive advantage. And the role that we want to play is to be leading and driving that revolution and being the orchestrator of the ecosystem.
I just wondered what's the next frontier for healthcare in this technology arena, and how will this impact delivery in practice?
There are two key pillars when it comes to healthcare, revolutionizing the healthcare. One is the industrialization of care, value-based healthcare that is focused on improving clinical outcomes, patient outcomes, financial outcomes, also efficiency. The second pillar is the personalization or the consumerization of healthcare. So you will see a tendency that more and more people and individuals want to be empowered to take care of their own health and well-being. And when they are at risk, being coached to avoid that their chronic condition, for instance, deteriorates. We as a company, Philips, have the advantage that we have both a strong professional franchise in this field, as well are we a strong consumer brand and are very strong in access to consumers around the globe. So by combining those two fields of strength, we feel we can play a leading role in driving this revolution.
Now, final question. I wanted your key moment of the week here at Global Dev Week in New York. What's really caught your eye in the field of healthcare or beyond?
Well, one of my key takeaways was a meeting, a conversation, and this was really stunning, where we talked about value-based healthcare and outcome-based healthcare, and we know that radiology is one of the main sources and drivers of healthcare cost. And there were some leading radiologists in the room, and one of them had the courage to stand up. I would struggle, he said, to give you one or two metrics that would substantiate the value that radiology brings to the healthcare system. We measure what we do in terms of output, number of patients, number of scans. And he says, I realize that that's not good enough. We need to find metrics that relate more to impact. And for me, that was a key takeaway and also a clear proof point that the awareness is increasing, that we need to change and challenge our own thinking and paradigms.